Scapular stabilized GH rotation, NMR level 2. Awesome, and rest. In the scapular stabilized GH rotation NMR level 2 exercise, you'll do the same as in level 1. First, you'll make sure that on the bench that you do not have hyperlordosis, so the lower back is not excessively arched. A little arch is just fine. You'll do that by pulling down the anterior rib cage a little bit, bracing a little bit from the abdominals. So doing that there, and then the chin is directly into the bench. You can have a paper towel there to keep that surface area clean. Draw the scapula into scapular stabilized position, which is retraction, depression, scapular external rotation. As you see Matt has here, the arms are in range of horizontal abduction, about 80 degrees of abduction, so like this position here. One arm will go into external rotation, while the other arm goes in internal rotation, and then you'll switch. Other arm into external, internal, and just go into those opposing directions. Keep that motion going, Matt. And while you're doing this, you're consistently having the scapula in that scapular stabilized position. For fitness doctor practitioners, a couple things that are really important for you to know. And that's, you just saw Matt do this exercise absolutely perfectly. But clients may have trouble doing this exercise absolutely perfectly for a few reasons. One of which you would have already worked on in other areas, getting into that scapular stabilized position. So we won't focus on that here because that advisory is picked up in other exercise descriptions and other protocols. So let's assume they already have scapular stabilized position. Some of the difficulties that you're going to find in this exercise with clients is they may have a limitation in doing internal rotation with this degree of shoulder abduction. They might find it almost impossible to do any kind of rotation unless their arm is all the way down in this position. And that is okay. But what you don't want to happen is clients start turning this into kind of a tricep extension. This is very common that clients they'll come here, they'll do the rotation that way, then they'll come back and almost kind of just kick back like a tricep kickback. That's not what we're trying to do. So if they need to come down into a lesser degree of shoulder abduction, that's fine. Just try to get them to rotate into that internal rotation the best they can. They may feel some restriction in the external rotation. And if they do, it's best open that shoulder up. So open the shoulder up means the elbow opening up a little bit, and then also making sure they have at least 90 degrees of shoulder abduction. So opening the elbow and making sure they have at least 90 degrees of shoulder abduction. That'll really help get the client into a position where at least they are getting in internal rotation and in external rotation.